This is Scott Becker with the Becker's Healthcare Podcast. I'm thrilled today to be joined by Dr. Valerie Kading. Dr. Kading is the Group CEO at the Sierra Tucson Behavioral Health System. We'll get a chance to talk to Valerie today about sort of her journey to leadership, big trends in behavioral health, and more. Dr. Kading, can you take a moment and introduce yourself?
Sure. First, Scott, thank you so much for this time together, and I am certainly very honored to be on your podcast. So I am a doctorate prepared psychiatric nurse practitioner. I've been practicing in the mental health field for over 15 years as a medical provider, administrator, and educator. I've been with Sierra Tucson since 2015, and Sierra Tucson is a mental health, substance use facility that provides residential care and also inpatient services. And I am, again, the group CEO of the Sierra Tucson Group. Most recently, I was the CEO of Sierra by the Sea and Sunrise Ranch, which are part of the Sierra Tucson Group, and they're located in Newport Beach and Riverside, California. I've lived in Tucson, Arizona since 1992, grew up in Arizona, so it is really an honor to be back here in Tucson after being in California for a few months. And you started at school at the University of Arizona back in 1992 and have been here really ever since then, except for, again, the 9 months that I was in California.
Well, fantastic, and you've built a great reputation. Take a moment and give us the state of behavioral health today. What do you see? What's evolving? Just a minute or two on what do you see going on in behavioral health and sort of, big strokes.
Sure. So behavioral health treatment is really increasingly in the media, the mainstream media, and especially now that we've seen a focus on mental health impact of COVID-19, we're really beginning to acknowledge that isolating, this loss of employment and stress and anxiety associated with COVID is leading to this mental health crisis. So it's affecting many of us in terms of depression, anxiety, and especially with healthcare providers. So we know that our healthcare providers are really experiencing this anxiety stress, and we're going to start to see an increase in the need for mental health treatment, especially for our healthcare providers. We've also seen a shift towards acknowledging that trauma is critical to addressing mental health issues and also substance use disorders. And, we could really say that this pandemic has really been a very traumatic situation for many of us. And so, again, we will start to see this mental health impact in this society. Also want to share that, this focus on women's mental health issues over the last few years has really been prominent and one that is long overdue. So having a focus on women's mental health issues, including postpartum depression and perinatal mood disorders, I'm really glad to see that we're addressing those issues as well.
Thank you very much. Just a great deal of media finally focus on mental health, a lot of issues that will come out of COVID-19 for all kinds of reasons, as well as a lot of focus on women's behavioral health, which is so critical too. Talk about, you've had a great career in leadership in the behavioral health field. Talk about two different pieces of advice that you would give to fellow leaders, whether in the behavioral health world or not. What advice and thoughts do you have for people emerging as leaders?
The first thing is you should never stop learning and growing, and really embrace the opportunities that are presented to you and also make opportunities. It's very important that we don't stop learning or growing. In the health industry especially, everything's constantly changing. So what we knew 2 years ago, 5 years ago is very different than what we know today, and that we must stay ahead of our field. So continuing to attend conferences, read journals, and stay curious. And I would even add, if you need to go back to school because you feel like there's additional education you may need, then go back to school.
So the first concept is never stop learning.
Yes.
What other thoughts do you, and I love that. What other thoughts do you have for leaders? What other ideas do you have?
So listen deeply to others around you, and that's also part of learning. Understand what's going on around you. Listen to the people on your leadership team. Listen to the people that work in the organization at all levels. So getting a good understanding of what's important to those who are around you, and then also understanding what makes them thrive and act on them, and really be a leader that's involved at every level and be available and someone that's very approachable. You want to make sure that people feel comfortable talking with you about the great things that are happening in the organization and also the things that aren't going so well in the organization.
Thank you. A lot of accessibility, a lot of listening, a lot of staying in sync with the team that you're managing and working with. And then take a moment and talk about your own journey to leadership and your own career evolution.
So looking back, I could say that my path to leadership has been not a straight path forward. It has been one that has been adventurous, it has been exciting, and it has been at times very unpredictable and unexpected. What's been common throughout this whole thing is that, again, I have never stopped learning. I have accepted various challenges throughout my career, and I've explored various roles. And so I started off working as a psychiatric nurse practitioner directly with patient care, and then from there accepted challenges in terms of administration, also teaching at a university as I continued a full-time job working as a psychiatric nurse practitioner, and then along the way realized that it would be in my best interest and continued learning by going back to school and getting my doctorate of nursing practice, and then most recently my MBA last year. And so again, I've always been excited and passionate about growing and learning, and that has taken me at every step to the next level, and being very grateful and humble at the same time.
So fantastic. And what a fascinating career. What has surprised you about behavioral health over the last 15 years? What has surprised you? Anything that sort of like you happened that you didn't expect, or evolutions that happened that you didn't expect?
When I first started my career, there was such a focus on the prescriptions of medications to treat mental health issues, and over the years, in my experience, there's been such a very positive evolution of now understanding that the medications aren't the answer to mental health issues, and that again, working on trauma and working on issues related to your childhood trauma experiences, using interventions like meditation and mindfulness are all just as equally as important as sometimes taking that medication. So a holistic view on mental health is what we're seeing, and what evidence is pointing towards in terms of recovering from mental health issues.
In talking about mental health and self-care and so forth, what other things do you look at and say, these are fundamental good practices for mental health, for self-care, and any other thoughts along those lines?
Absolutely. So integration of the medical component and physical component to mental health. So making sure that you're exercising, your diet, nutrition, those are all things that we are now focused on in terms of mental health, whereas, again, those things weren't so much connected to mental health, 15, 20 years ago, and now those are all integral pieces to improving your mood, improving your mental health.
And Dr. Kading, a pleasure to visit with you today. Congratulations on your ascension to serving as CEO of the Sierra Group president. Just fantastic. Anything else you'd like to leave with our listeners today?
I would just like to share that there is hope for the future, and that it is really a pleasure to see that many of us in the mental health field are addressing the needs that are now presenting to this world, given the pandemic and given all of these recent concerns that we've had, and that we are addressing these issues, being very agile, and wanting to help as many people out there as possible. And there is hope and help out there.
Well, thank you very much, Dr. Kading. We appreciate your time so much, and what a great leader you are. Thank you very much.
Thank you so much, Scott.